All right, so as some states see a record number of coronavirus cases, some officials are beginning to acknowledge that some of these states may have started to reopen a little too soon, and perhaps it was a mistake.
I think right now we're where we were when New York City was having its peak epidemic. We're going to see deaths creep up, and I wouldn't be surprised in the next 2 weeks to see deaths go over 1,000.
And to make matters worse, a packed 4th of July weekend is fueling fears that the celebrations could trigger an explosion of the nation's already surging outbreak. Nancy Chen has the latest from New York.
The mayors of 2 of the biggest cities in Texas fear their hospitals are about to be overwhelmed.
The number of people who are getting sick and going to the hospitals has exponentially increased.
If we don't change the trajectory, then I am within 2 weeks of having our hospitals overrun.
Texas is one of a handful of states seeing a record number of hospitalizations due to the coronavirus.
Medically, we are improving, but we just have so much infection around this country. We're going to see, unfortunately, a lot of lethality.
Capacity is also nearing its limit in Arizona. Phoenix Mayor Kate Gallego says FEMA declined to bring more testing to the area.
We were told they're moving away from that, which feels like they're declaring victory while we're still in crisis mode.
Florida is reporting nearly as many new cases each day as New York did during its April peak.
We're only as strong as our weakest link right now.
New Jersey Governor Phil Murphy says residents coming back from hotspots are bringing the virus with them.
We cannot afford to go through hell again. We need a national strategy, I think, right now.
Over the holiday weekend, many tried to maintain social distancing. But this video of a lake party in Michigan shows some didn't bother.
We decided we're done with it.
Washington Nationals pitcher Sean Doolittle says sports are the reward of a functional society.
If there aren't sports, it's going to be because people are not wearing masks because the response to this has been so politicized.
Major League Baseball is scheduled to begin July 23rd. Nancy Chen, CBS News.
All right, so for more on this, let's bring in Dr. Ron Elfenbein. Doctor, you are an emergency care physician in Maryland. So just taking a look at the numbers, coronavirus by the numbers, the 7-day average for daily new cases in the U.S. reached a record high for the 27th day in a row. We saw a little bit of what's happening in New York. I know here in Pennsylvania, the numbers started to tick up, and the governor is blaming it a lot on people, heading down the shore, heading, as we say, going down the shore, heading to the Jersey Shore for the cooler breeze by the ocean and, perhaps sharing homes with people that are not within their family unit and then coming back to Pennsylvania infected. What do you see as the cause for this uptick in cases?
Well, I think it's very much multifactorial, and anybody who says otherwise, I think, is lying or is misinformed. You raise a very good point. A lot of it is because people are frankly tired and dismayed that they've been kind of locked up for 3 months, and they just want to go out and enjoy their friends and see their friends and enjoy their lives. And people just, are people, and they're not as cautious as they were 3 months ago. And people are interacting more with other people and things as we kind of relax this a little bit. So there's that. And then, you look at, for example, Texas, the numbers skyrocketed in Texas for a while. And part of that was because they were testing more, for example, in prisons, and there was a higher incidence of the virus in prisons. You look at Georgia, you look at different states and how they test and who they test, and all these things kind of, you're somewhat comparing apples to grapefruits. So it's difficult to look at and find a single defining reason for why this is happening. But I believe that the biggest one is the thing that you hit on, which is that people are just tired and frustrated, and they just want to go back to their lives. And, they're getting a little more complacent than they were 2-3 months ago. And unfortunately, I think in the next week or two, we're going to see a very large spike because of the 4th of July festivities, just like we did with Memorial Day.
Yeah, I can see it. I think there's just sort of a level of exhaustion, and we've talked about this before. I think there's a sort of coronavirus exhaustion, but also a little confusion as to how to behave precisely. If you're wearing a mask, should you also stay 6 feet apart? As there are reopenings across the country, I think we haven't gotten sort of clear instructions on how we behave once we leave our house, which we will get into, but I want to get to this. This whole controversy about what the president said during his 4th of July speech. We're saying that 99% of coronavirus cases in America are, quote, totally harmless. Now, I know totally harmless is not a medical term, so I can't, guess what the president what he defined as a harmless case. Does he mean asymptomatic? Does he mean, mild symptoms? I'm not sure what he means by that, but can you just sort of give us the facts? If I said to you 99% of the cases are totally harmless, you say what?
Well, I mean, you're right. It's not a medical term. I think what he meant, and I'm not obviously in his head, and I don't want to hypothesize what he was trying to say, but I think
here we want facts.
Right. So I think what he's talking about is that the vast majority of these new cases we're seeing are in the demographic younger than 40, and those people tend to have an incredibly low incidence of mortality when it comes to the coronavirus, meaning that very, very few people in that age group will die from their infection. Most people in that age group tend to just be, hey, I feel like I got the flu, I got a bad cold, I had a cough, and they're fine. The real problem, though, is that those people who have minor symptoms, they live with their parents, or they go see their grandparents or their great-grandparents or their great-aunt or whomever who's above 50 or 60. And those people tend to have a very high mortality rate. As your age gets higher and higher, certainly above 60 years old, the mortality goes really, really high. So, the fact that the majority of these cases that we're seeing, the numbers spiking now, are in younger people is not all that concerning, except for the fact that those people will infect older people, and those people will definitely be dying from this virus. So, I don't really know what he meant by that, and it's kind of a misleading way to put it, if you will. I'm not really sure, and it's certainly not a medical way to define this outbreak.
Yeah, it's a little imprecise. Okay, so now I want to ask you about the science, which I think that, there's a lot of debate about this virus. We learn new things every single day. As you know, New York City is sort of moving forward with its reopening. It's one of the brighter spots in the country in that it's managed to get a handle on the cases here. But the governor has decided to halt the plan to allow indoor dining. And one of the concerns is that there are a number of scientists that say that particles floating in the air from people talking and eating in an indoor space can carry the virus. The WHO, however, says that the evidence is inconclusive when it comes to that. What can you tell us about eating, talking, laughing in these enclosed spaces and your vulnerability to the virus?
Well, so you're right. The World Health Organization is really sticking to their guns on this, and they're saying that it is not an airborne virus. It is purely spread by respiratory droplets. The only time it becomes airborne is when we do procedures like intubation that causes aerosolization. So meaning that particles smaller than 5 microns can actually get in the air and spread. And that's the only time that happens, according to the World Health Organization. But 240 scientists from 32 countries just came out and said, we disagree with that, and we believe that this virus is airborne and can be spread not just in respiratory droplets, which are why we social distance. Respiratory droplets are very large droplets that when you sneeze, for example, they shoot out of your mouth and they drop right to the ground because of gravity. Whereas airborne means that the virus can hang out in the air for a long time, and all you have to do is walk by a cloud of this and inhale it, and you're going to catch it. So these 240 or 239 scientists, I can't remember how many, from 32 countries have said that they believe that there's very compelling data to suggest that it is, in fact, airborne and can be spread through just breathing, laughing, talking. So I have seen the data, and I tend to agree with them that there is some concern that this virus can be airborne, not just during medical procedures. So the idea being that if you're going to go out for dinner, for example, you really should sit outside, because the UV light and the fact that there's wind and things like that tend to make it much less likely that you're going to catch this virus versus being in an enclosed space with a lot of people. Even if you're 6 feet apart, your risk is much higher. So the data, the jury's still out on this, but I believe that the data that I've seen tends to weigh more heavily on this being an airborne virus rather than purely respiratory droplets, if that makes sense.
Yeah, that makes a lot of sense, and you've given us a lot of insight. I always prefer eating outside anyway, so it works just fine for me. Dr. Elfenbein, thank you so much.
Thank you, Emery.